Good morning, everyone. My name is Dr. Mahinder Singh Chauhan. I'm an associate professor in School of Dental Sciences, Sharda University. Today, I shall be discussing about the surveyors and the methods of surveying in this lecture. The contents will be the introduction of the surveyors, the definition, the key terms, the history of the surveyor, recent advances, parts of the surveyors, purpose of surveying, steps in surveying, tripoding, path of insertion, factors affecting path of insertion, survey lines, block out, relief, maintenance, review of literature, conclusion, and in the end, there will be references of this lecture. We shall start with the introduction. Any asymmetrical clusters of teeth that usually lack parallelism require surveying. The crowns of these are irregularly convex in shape, separated by areas of residual ridge of varied length and breadth. Surveying, it is an integral part of the RPD planning. There is a systematic design required, mechanical principles that needs to be followed, and biological principles to keep patient healthy and sound and the chewing comfortable for them. What is a surveyor? A paralleling instrument used in construction of a dental prosthesis to locate and delineate the contours and relative positions of the abutment teeth and associated structures. That is according to the GPT-9. What McCracken says, it is an instrument used to determine the relative parallelism of two or more surfaces of teeth or other parts of the cast of a dental arch. Now, what is surveying? Surveying, it is the analysis and comparison of prominence of intraoral contour associated with the fabrication of the dental prosthesis. And the instrument used for surveying is the surveyor. What are survey lines? A line produced on a cast by a surveyor marking the greatest prominence of the contour in relation to the planned path of placement of a restoration. Now, coming on to the history of surveyors. In the initial days, there were arbitrary techniques that were followed before the invention of the dental surveyor. The dentist evaluate axial contours and undercuts of the teeth by visual surveying of the dental cast in around 1980s. Next, they started using parallelometers, an apparatus used for marking, for making one object parallel with another object, as in paralleling attachments and abutments for the fixed dental prosthesis, or precision attachments for removable partial dentures or removable dental prosthesis. That was developed by Dr. Kais in 1906. This is a parallelometer that we can see in the picture. Then the first dental surveyor, the bridge parallelometer by Dr. A.J. Fortunati, was the first to demonstrate the advantages of using a mechanical device to map the contours of the abutment teeth in 1918 at Dental Clinic, Boston. Later on, Stanton and Hanau dental surveying apparatus was, it was introduced into the market in 1917, but nowadays it is discontinued because of the various drawbacks of this machine. Next was the Robinson surveyor in the Philadelphia dental clinics in 1918. First commercially available dental surveyor, it was produced in 1923. Next is the current surveyors that we are using are Ney's surveyors and the Jelenko's. The Ney surveyor was introduced in 1937, as we can see in this picture B. It is the Ney surveyor. Next, the originally Willys surveyor in 1929, developed by the Noble J. Willys. Modifications: Wills surveyor in 1937, came into the market. Later on, the electronic surveyors were introduced into the dental fraternity. It was developed at the United States Air Force School of Aviation Medicine at Randolph Air Force Base in 1958. Next is the Ney's and the Jelenko surveyors. What is the basic difference between these two? In the Ney's, horizontal arm is fixed, whereas in case of Jelenko, when the nut at the top of the vertical arm is loosened, the horizontal arm may be made to swivel. We can move it around, and we can do the surveying properly by moving the horizontal arm. What about the vertical arm? In Ney's, retained by the friction within a fixed bearing. whereas in case of Jelenko, spring-mounted return to the top position when it is released. Later, they came with the optical surveyors devised by Yilmaz in 1975. The cast is illuminated by a parallel beam of the light. This beam of light is set parallel to the marker rod of the surveyors. The shadows are indicated as the undercuts, and the borders of the bright and dark areas indicated the survey lines. Later, the modifications of the surveyors, multiple surveying arm, micro surveyors were introduced. The retentoscope, the saddle lock company, they produced the blockout surveyors. Broken arm surveyors were there. Additional, a broken or hinge or horizontal arm facilitated surveying and allowed use of a milling machine through adaptation of a straight handpiece to a surveying arm. Kai's milling machine, these milling machines, dental surveyors function as the milling machines or drill presses that developed for the precision attachment applications, ensures parallelism of the guiding planes milled into the castings. The recent advances in case of surveyors, now the lasers have been introduced into this machine. The surveyors dramatically exposes the undercuts areas by projecting a beam of laser light. The prototype surveyors Intratec Dallas TX is used. Later, the 3D computers aided designing is done. Electronically surveying the cast, depth of the undercuts is determined from the definite cast. The programs were written for the technique using mathematic software, MATLAB, the MathWork, and etc. Next is the parts of the surveyor. And the parts, we have a level platform on which the cast holder is moved. It is parallel to the bench top. As we can see, the arrow is indicating the platform. A cast holder, next is the cast holder. This one where my cursor is, this is the cast holder. A cast holder or the surveying table supports the cast to be analyzed. This cast holder holds the cast, which needs to be analyzed, where we need to mark the survey lines, where we need to locate the undercuts, and accordingly, we plan the tilt of the cast on the basis of the undercuts. Everything is done on this cast holder. This picture, this arrow which is showing, it is the cast holder. We can tilt the cast holder. There is a pivoting joint over there. Ball and socket joint is over there, where we can tilt the cast and plan our undercuts. Next is the surveying arm. Surveying arm drops vertically from the horizontal arm, as we can see in this picture. Sorry. It drops vertically from the horizontal arm, and that is capable of vertical movement. It's lower and has a mandrel capable of holding the surveying tools. Next is the horizontal arm. It is parallel to the horizontal platform and perpendicular to the vertical and the surveying arm, which it connects. Here, A, we can see, is the horizontal surveyor base. B is the upright column. C is the cross arm with spindle bearing. D is vertical spindle. E is spindle tightening screw. F is tool holder. We can appreciate in this figure. And G is tool holder locking nut. H is survey table. J is tilt top and model clamp. K is locking screw of the tilt top. L is ball pivot. M is ball retaining ring. N is rack of accessories when it is in use. O is storage compartment, and B is the model clamp adjusting screws. Next is the surveying tool. Analyzing rod, paralleling tool, guard line markers, carbon markers with the metal reinforcement sheath, undercut gauge, block out tools, tapered. Basically, they are tapered 2 to 6 degrees. And when the parallelism is desired, the nave X trimmer for the paralleling block out, and surveying blade we have. Surveying blade, as we can see, these blades are used to trim the wax when we are doing the wax blockouts. These can be used for the FPD purpose also. Analyzing rod. This tool contacts the convex surface to be studied in a tangential manner. relative parallelism of one surface to another is determined. It is used to scribe the survey line and to delineate and undercut areas of the soft tissues or the ridge. These are the carbon markers, and we can see the line which is formed. It is marking the most prominent area of the tooth. Under this line, we have the the retentive arm gets fixed over there. Above that, we keep the reciprocal arm. We shall discuss it in the successive slides later on. Next is the undercut gauge. We can measure the undercut, how much it is present, and accordingly we can plan the tilt. Used to identify the specific amount and location of the desired undercut and the undercuts on the surface of the abutment tooth. Undercuts can be desirable and non-desirable. That we shall discuss in the successive slides. Amount of undercuts to be measured in hundredths of an inch, that is 0.01. It is the cast retainer's most desirable undercut. 0.02, it is for the wrought wire retention. 0.03, it is rarely used. It is very less. Block out tools or the wax knife. This instrument is used in the later stages of the removal partial denture construction to eliminate or block out areas of undesirable undercuts with the wax on the cast before the framework is made. And we can see in this picture, this is the blade which is trimming the excess wax when we are doing the block out, and it is the nail surveyor blade that has been used in this picture. It is tapered 2 to 6 degree when the parallelism is required, parallel block out, and the block out extends from the survey line to the gingiva. This is the nail wax trimmer. As we can see, these are the undercuts in this diagram as indicated, and they are trimmed using this trimmer. Next is, what is the purpose of surveying? Why do we need to do the surveying? Surveying the diagnostic cast, recontouring the abutment teeth on the diagnostic cast, contouring the wax patterns, measuring a specific depth of undercuts, surveying ceramic veneer crowns, placing intracoronal retainers, placing internal rests in the machine, cast restorations, surveying and blocking out the master cast. These are the purposes of the surveyor we need to do on the various casts. Surveying the diagnostic cast, it is to determine the most desirable path of placement that will eliminate or minimize the interferences to the placement and removal of the prosthesis. It makes the patient to easily remove or place the prosthesis. To identify the proximal tooth surfaces, that needs to be made parallel as they act as guiding planes during the placement and removal. To locate and measure areas of teeth that may be used for retention, means the undercuts. To determine whether tooth and the bony areas of interferences will need to be eliminated surgically or by selecting a different path of placement. To determine the most suitable path of placement that will permit locating retainers and artificial teeth to the best aesthetic advantage. To permit an accurate charting of the mouth preparation to be made. To delineate the height of contour on the abutment teeth and to locate areas of undesirable undercuts that needs to be avoided, eliminated, or blocked out. To record the cast position in relation to the selected path of the placement for the future references. Next is the survey lines. Why do we need to mark the survey lines? This concept was first introduced in 1916. It is based on the Cohen theory for the clasp retention. Devan in 1955 referred to the surface occlusal to the height of contour as suprabulge and the surface inclining cervical as infrabulge. These are the survey lines. As we can see where my cursor is, the area above these survey lines is the suprabulge and the area which is present below these survey lines is the infrabulge. Blatterfin classified these survey lines as the medium survey line, diagonal survey lines, high survey line, and the low survey lines, depending on the height of contour of the tooth, whether the height or the most prominent part of the tooth lies very high onto the near to the occlusal surface, or it is lying very near to the gingiva. According to that, we classify them, or the Blatterfin classified them as the medium, diagonal, high, and low survey lines. Next is the color coding. Brown pencil, it is used to outline the metallic portion. When we are designing an RPD, the brown pencils are where the brown markings are there. That area is to be filled with the metal portion. The blue crayon pencils, they outline the acrylic portion of the denture base. Red ones to indicate the areas on the teeth that will be prepared, recontoured, or relieved. Placement of the tripod marks. Surface that is to be recontoured and outlined red and filled with the evenly spaced diagonal lines. All these markings will be in the red. Soft tissue areas that require relief are outlined in the red, accompanied by the word relief. Solid red, it is for the rest and the rest seats. Black pencils or the carbon markers, they are used to denote the survey lines and enter the information on the basis of the cast tooth replacement, type of class, depth of the undercut. Now, survey, how do we process the whole surveying thing? Identifying the most favorable tilt. We have to identify it for the aesthetics guidelines and the interferences. We need to check the path of insertion, tripoding of the cast is to be done, placing the survey lines and marking the undercuts, that is to be done. Surveying step-by-step procedure. First of all, we do the orientation of the cast. Next is the cast tilting, visual analysis using analyzing rod, decide on the tilt and mark the survey lines. Soft tissue undercuts using the carbon markers, undercut gauge used to measure the amount of retention. Path of placement and removal, factors influencing the path of insertion, guide planes, and the tripoding. Next is the orientation of the cast. How do we need to orient the cast onto the surveying table? Cast oriented such that the interior part is always towards the vertical member of the surveyor and away from the operator. All the casts are considered as lower cast in the standard position. And we can see in this picture, this is the interior part of the cast that is to be placed in this direction. Method for manipulation of the surveying. Right arm, if you are a right-handed person, we need to hold the cast or the cast holder with the left hand, and the vertical arm is held with the help of the right hand. The right hand braced on the braced on the horizontal arm of the surveyor to raise and lower the vertical shaft in the spindle. Also to tighten and loosen up the tilt once its position is placed. Left hand is used to adjust the tilt of top. Like the cast holder, we need to tilt. The amount of the tilt that is required, it is to be done with the help of the left hand, and the surveying and the markings are to be done with the help of the right hand. Primarily, visual assessment of the study cast is to be done. Then we do the tilting, changing the position of the cast, which thus changes the long axis of each tooth relative to the horizontal plane. As we can appreciate in this diagram. Why tilting is done? To obtain the most advantageous path of insertion. Establish a more desirable undercut on other teeth involved in the design. Distribute available undercuts to produce more uniform retention throughout the available teeth. Tilting may be used to increase the desirable undercuts and to decrease the undesirable undercuts. Through tilting, it is possible to increase the undercuts on the other side of the tooth while decreasing them on the other side of the tooth. By tilting, we can change the undercuts, we can change the degree of undercut, we can change the favorable into unfavorable ones, unfavorable ones into favorable ones. We do it according to the placement and the removal that is to be done by the patient of the prosthesis. Basic tilts. The basic position or the tilt of the cast on the surveyor should be the horizontal tilt or the zero tilt. Occlusal surfaces of the teeth are at or nearly parallel to the horizontal plane, the standard reference position from which further tilt originates. It means we should try to keep the tilt minimum. It should be 0 degrees in the ideal conditions. This is the anterior tilt we can see on the right side. Left side we can see the posterior tilt. These tilts, as we can see in this picture, this premolar is not having an undercut in the left picture, but in the right one, the premolar is having an undercut, but the undercut of the molar is relieved, or it is adjusted. This is light lateral. These are the markers. This is the left lateral tilt. As I said, we need to, while tilting, we need to make the unfavorable undercuts into the favorable ones, so that our fabrication of the prosthesis, our fabrication of the cast partial denture is easier, and it is easy for the patient to place the prosthesis in his mouth, in his or her mouth, and remove it easily. Next is the path of insertion. The specific direction in which the prosthesis is placed on the abutment, the teeth or dental implants, parallel to the vertical arm of the surveyor, determine the tilt of the cast on the surveying table, indicated by the vertical spindle of the surveyor in relation to the occlusal of the cast or the tilt. Mandible is straight down, maxilla is straight up. Next is the class 1 arches and the class 2 without modifications. I hope we all are aware of the Kennedy's classification and the applicate rules. Here we are talking about the same class 1 arches and the class 2 without the modifications. There are no modification spaces. Bounded by teeth at only one side, and multiple paths of insertions can be possible. Class 2 modifications. The modification spaces will determine the path of insertion. If the guiding plane is prepared, the single path of insertion can be achieved. Class 3, entirely tooth bounded, guide planes on the proximal surfaces, single path of insertion. Class 4 is parallel to the guiding planes on the abutment teeth, adjacent to the edentulous spaces, single path of insertion. Advantages of single path of insertion. It equalizes the tension on all the abutments. It provides bracing and cross-arch stabilization of the teeth. Minimizes torquing forces of the partial dentures on the abutment teeth. Allow the partial dentures to be removed without encountering interferences. That directs the forces along the long axis of the tooth. Provides frictional retention from the contact of parallel surfaces to the tooth. In order to provide a single path of insertion for a partial denture, some axial surfaces of the abutment must be prepared so that they become parallel to the path of insertion. These parallel surfaces are called as the guiding planes. As we can see in this picture, it was an interference in the placement. In the second picture, we can see we have flattened that projecting part. It means we are making the guide planes. These are the planes that will guide your prosthesis to be placed properly into the patient mouth. Factors affecting the path of insertion. Basically, when we are designing a prosthesis, many things affect the fabrication. Aesthetics, guide planes, interferences if they are present, retentive undercuts. All these are managed properly, then only we can make a proper, good design for our RPDs. Retentive undercuts. Surveying procedure is always started with the cast to be analyzed, positioned in the cast holder so that the occlusal surfaces are in the horizontal plane and examined for the presence of retentive undercuts. Ideal undercuts for an abutment of 0.01 inch. In all cases, undercut should be located in the apical third of the clinical crown. Depending upon the practitioner's classing philosophy, we have distolingual line angle, mesiobuccal line angle, gingival third of the clinical crown, and mid-face surfaces. We need to direct uh, you know, forces properly directed perpendicular to the occlusal plane. They are pull produced by the sticky food, and next is the forces of the gravity in case of the maxillary dentures, and these are the dislodging forces. Retentive undercuts must be placed on the abutment teeth when the cast displays a horizontal tilt. These undercuts are not if the undercuts are not present, must be created in the mouth. I told you in the beginning only, we need to create the undercuts for the to make our prosthesis retentive into the patient mouth. So we need to tilt the cast accordingly, or there are many other methods to create the undercut, like dimpling out. Retentive undercuts change a path of placement to increase or decrease the angle of convergence of opposing retentive surfaces of abutment teeth, decrease the torquing forces to the abutment teeth, place the fixed restorations, gold crowns. Carefully, we recontour the enamel surfaces, alter the flexibility of the clasp arms by changing the design. Tilt is changed so that the retentive clasp will be positioned no further occlusally or incisally than the function of the gingiva and middle third of the teeth. Next is the interferences. Certain structures in the oral cavity may interfere with the insertion of the RPD. This is by changing the tilt of the cast, it can be managed, or surgical intervention may be required. The interferences can be in the form of teeth, bony prominences, soft tissue undercuts, and exostosis. Minimize the surgical procedures, never compromise the restorative outcome. These are the principles that we need to keep in mind. We should minimize the surgical procedures, but we should never compromise with the restorative outcome of the prosthesis. In case of maxilla, palatal torus can be a interference. Buccal exostosis and undercuts can be interferences. Facial tipping of the posterior teeth, that can be in interferences. In case of palatal torus, we need to alter major connector design, or surgical removal it can be an option. In case of the buccal exostosis and undercuts, increased accumulation of the food will be there. Decreased denture stability can be encountered. In the facial tipping of the posterior teeth, we have height of the contour moves towards the ocular surfaces, the gingival tissues in the undercuts. In case of mandible, interference can be in the form of mandibular tori, lingual tipping of the posterior teeth, areas adjacent to the pear-shaped pads, and the bony prominences. In case of lingual tipping of the posterior teeth, there is no undercut on the facial surface. In case of the bony prominences, the facial surface of the mandibular canines and premolars. Alter the major connector design, recontouring of the teeth, orthodontic correction can be required sometimes. Tilting of the cast is one of the options. In short, we need our prosthesis to be comfortable for the patient, whether in case of the placement or in case of the removal or while chewing. We have to manage. We need to eliminate all the interferences by doing surgical procedures, or doing by orthodontic corrections, or by recontouring of the teeth, or by tilting the cast. Anyhow, we have to manage the interferences. Next is the aesthetics. Metal, usually in the form of clasp arm, must be concealed as much as possible without compromising the necessary support and stability of the prosthesis. Anterior artificial teeth should be placed in the most natural position. Avoid unnecessary display of the metal. The ideal position of the retentive clasp is in the gingival third of the clinical crown. The prosthetic teeth must be selected appropriately, contoured, and positioned. Guide planes, two or more parallel axial surfaces on the abutment teeth, which can be used to limit the path of insertion and improve the stability of the removal prosthesis. The surveyor locate the existing or the potential surface of the teeth that can be converted to the guide planes by selective grinding. formed on the proximal or the axial surfaces of the teeth, contacted by the minor connectors or the rigid element of the partial dentures. Guide planes needs to be parallel. They should be always be parallel to the planned path of insertion, rarely greater than 2 to 4 mm in height. They stabilizes the prosthesis against the lateral forces, ensures the predictability of the clasp assembly function, prepared most on the enamel surfaces, also on the cast restorations while doing wax patterns. It protects the weakened teeth from destructive or lateral forces. These are the functions of the guide planes. But keep in mind, they should not be greater than 4 mm in height. What is tripoding? After final tilt of the cast has been selected, it must be recorded so that the cast may be later repositioned precisely. This procedure is referred as the tripoding. To make a plane, we need to mark 3 dots. That is why we need the tripoding. Why tripoding is done? Returning to the surveyor for the future references, especially during the mouth preparations, returning working cast for shaping wax patterns, trimming block out on the master cast, locating clasp arm in the relation to the undercuts areas. How do we do the tripoding? A 3 cross mark, each line 3 mm wide, dots on the tissues portion of the cast, lingual to the remaining teeth, at widely separated points with the vertical arm of the surveyor are maintained at the fixed position. Analyzing rod should be fixed. Dots or the marks are encircled with a colored pencil for easy identification. Horizontal lines should be about 4 mm long and relatively narrow. And we can see these 3 dots. These are planned according to the tilt, according to the undercuts onto the cast. They can be on the soft tissue areas or they can be on the hard tissue areas. But the area, the 3 marks should be there. They are 3 mm, the 4 mm long and relatively narrow. Method 2 is Next is surveying the master cast. Surveyed as a new cast, prepared proximal guide plane surfaces will indicate the correct anterior-posterior tilt. Any remaining interferences after mouth preparation must be eliminated with blockout. Tripoding is done, survey lines are marked. Next is blockout for the inconveniences. Relief beneath the connectors to avoid the tissue impingement. Ledges on which the clasp patterns are to be placed. Relief to provide attachment of the denture bases to the framework. Any undercut areas crossed by the rigid part of the denture during seating and the removal they are eliminated by the blockout. Material used for blocking out and for the relief: hard base plate flex can be used, oil-based clay we can use, adhesive wax can also be used to block out. Next is what is parallel blockout and what is shaped blockout. Parallel blockout is to make the abutment teeth parallel to each other so that the RPD can be placed or the minor connectors can be guided to make a constant proximal contact with the tooth. And the thickness of these waxes or the blockouts only to undercut remaining below the contact of surveyor's blade with toe surface or the cast. Next is the shaped blockout on buccal and the lingual surfaces to locate the wax patterns for the clasp. With hard wax plus wax, we can make the reciprocal clasp arm or the retentive clasp arm. The reciprocal clasp arm to follow the height or the convexity. The retentive clasp arm as cervical as tooth contour permits. Point of origin of the clasp to be incisal or occlusal to the height of convexity, to include the undercut areas in keeping with the flexibility of the clasp used. As we can see in this picture, in these pictures, these are the blockouts. We can see the reciprocal arm always rests above the blocked out areas, whereas in case of the retentive arm, The terminal third of the retentive arm engages the undercut and makes our prosthesis retentive, where the relief is to be given. The beneath the lingual bar or the connector bar or the bar portion of the lingual plates, 32 gauge wax. If slopes of the lingual alveolar ridge is parallel to the path of placement, 32 gauge wax after parallel block out of undercuts, if slope of the lingual alveolar ridge is undercut to the path of placement. Areas in which major connectors will be in contact with the thin tissues, such as the hard palate areas, so frequently for our lingual and the mandibular ridges elevate the palatal raphes. Contouring the wax patterns, surveyor blade used as the wax carver, it maintains the proposed path of placement maintained throughout the preparation of the cast restorations for the abutment teeth. We need to shape the wax. Next is the surveying ceramic veneer crowns, used to contour all the areas of the wax patterns for the veneer crowns, used to restore abutment teeth on which the extracoronal direct retainers are placed, except the buccal or the labial surfaces. Correct the contour to be ensured before glazing. You can see in this diagram, ceramic veneer crowns are analyzed and corrected before glazing. Placement of the internal rest seat. The surveyor may be used as a drill press with a dental handpiece attached to the vertical arm by the handpiece holder, the carved in wax patterns and refined further with the handpiece after casting. Next is the placement of the intracoronal retainers to select the path of placement in relation to the long axis of the abutment teeth that will avoid areas of interferences elsewhere in the arch. To cut recesses on the diagnostic cast for estimating proximity of the recess to the pulp used in conjunction radiographic information to establish the pulp size and the location. To carve recesses in the wax patterns or in the castings, keyway portions using handpiece holder ensures placement of each keyway parallel to other keyways elsewhere in the arch. Next is the machining cast restorations. With a handpiece holder attached, the refining of the axial surfaces can be done with a suitable cylinder carborundum points. Proximal surfaces of the crown and inlays to serve as the guiding planes. Maintenance: wipe the base of the surveying table and the surveying platform with the alcohol or acetone soaked gauge pad. Acrylic resin powder can be sprayed for smooth gliding. Machine oil should be applied to the vertical arm before and after use each time. Next is the review of the literature. Electronic surveying of the digital partially dental cast. The objective was to develop a method of surveying and digitalized partially dentate cast in order to accomplish computer-aided designing and the framework of the RPDs. Survey lines of digitalized partially denture cast were generated in the computer. The undercut areas and its depth were identified, and the undercut could be blocked out. The shape of the survey lines on the digitalized cast was similar to that on the physical cast that we are doing traditionally. Guide planes in the class reciprocation. According to this article, two factors that improve the retention and reciprocation in the class design are length of the guide plane, coronogingivally. This will adequately reciprocate the action of the retentive arm, the relation of the undercuts to the guide planes. With the degree of undercuts, the contour of the tooth influences the length of the guide planes. Optimum guide plane length to have adequate retention and to protect free gingival margin is about 5 mm. Next is the importance of the guide planes for the stability. It is an article from the JPD published in 2002. The flat axial surfaces in an occluso-gingival direction on the abutment are referred as the guide planes. They should be prepared to the parallel to one another and to the path of insertion. During insertion, the rigid parts of the prosthesis contact with these surfaces with the direct and the movement of the RPD until it's seated securely in the predetermined position in the mouth. Next is the accuracy of the digital removal partial dentures fabricated by casting a rapid prototype pattern. It was a clinical study in the JPD in 2017. The purpose of this clinical study was to analyze the accuracy of the digital RPDs by using the replica technique. The fit accuracy of the digital RPDs fabricated using electronic surveying was analyzed by fabricating replicas with silicone registration material and measuring with the stereo microscope. A total of 348 measurements in 10 participants were analyzed. The internal discrepancy of the metal framework was evaluated among the participants using the different kinetics classifications. These are the green one is the wax pattern. The design of the RPD, and we can see the casted, the RPD placed in the patient mouth in the last picture. Next is the conclusion. Here, to conclude with, the surveying, it is an important and indispensable step in designing a cast partial denture. Continued ergonomics refinement of the surveyor should ensure its continued use during the treatment planning processes. Intelligent use of the procedures will allow us to render superior services to the patients. These are my references that were used to make this presentation. Thank you so much.